So good morning, everybody, and welcome to our Thursday morning webinar. It's great to see so many of you on the call today. So obviously last week we did the first part of the APIE for the OSCE station, the clinical station, which is assessment, planning, intervention and evaluation. We did the first part, which was assessment, and I also showed with you our Devon Oski Handbook, which you will all be sent when you get your certificates of sponsorship if you're coming to work with us in Devon. We went through a training video of the assessment part of the APIE, and we linked back to the handbook so you could see exactly what you're going to be marked for, what the examiners are going to be looking at. And the first part of the Oski Handbook is really good because it just sets the scene in terms of the Nmc standards and that code of behaviour and practice that you're expected to demonstrate. Obviously, all of the OSCE stations are underpinned by the Nmc Code. So if you haven't done already, please have a look on the Nmc website because there's a wealth of information there for you. So what I'm going to do is I'm going to put up the OSCE Handbook in a minute on the screen, and then we're going to go through the planning station of APIE. And then we're just going to finish off with the meditation video at the end, which is designed by the Royal College of Nursing, and it's designed especially for care workers. So it's really relevant in today's sort of time, and given that we're still working through a global pandemic. Myself and Laura on a call a couple of days ago to Nalin, who I think is watching this morning. So Nalin's a nurse in Sri Lanka who's sitting his English exam in November, and he really gave us a good perspective of how things have been in Sri Lanka as a nurse working through COVID. And also from a personal perspective, because we're all trained and we're all professionals in looking after other people. However, when it affects one of our relatives, I don't know about you, but sometimes my knowledge feels like it goes out the window because it's very personal. So it just really brought home to me how important it is to look after each other. And I think a really great thing since the pandemic is that the NHS really focus on health and well-being of staff. That really seems to be a priority, and I think when you come over and work with us, you'll really recognise that. So obviously put your questions in the chat. We've got lovely Victoria joining us shortly, who will be able to answer your recruitment questions. But please remember, we have a recruitment webinar focus on the first Thursday of every month. Okay, so if you can save your questions until then, brilliant. If not, if it's a bit more pressing, then pop them in the group chat. So I'm just going to check there aren't any questions at the moment. So also an update and something I'm going to be advertising. Oh, hi, Nalin. I've just seen he's put, yes, I'm here. Hi. He's here. So next Thursday will be our last weekly webinar, and then they're going to be going fortnightly. Okay, so we will advertise that in advance. So we'll have the first Thursday of every month as a recruitment focus, and then the third Thursday will be me, and I'll be doing lots of different things as you've seen so far, teaching, introducing guest speakers. Bless Nalin, it's so good to see you, Carly and Laura. Thank you. Nice to see you on the call.
Nice to be seen.
Yeah, definitely. So what I'm going to do is I'm going to share the Oski Handbook, but please remember, follow us on our Facebook, follow us on Twitter. We've got our own YouTube channel. I expect Laura will pop up the links for that. If you don't follow us already, share us with your friends. Okay, spread the word, because we are recruiting in Devon, and you know, these webinars are here to provide support to you and reduce any anxieties that you may have. I'm always open to ideas for webinars, so if some of you think that it would be really helpful if I did a webinar on a certain topic, then let me know, because I'm open to any suggestions. Right, so let's see if I can screen share the Oski Handbook. Here we go. Right, Laura, let me know if you can see it.
Yep, and I'm sharing it now as well. There we go.
Okay, so this is our Devon Oski Handbook. Like I've said before, you will all get access to this when you get your certificate of sponsorship issued from the trust. So at that point of the onboarding phase is the point that myself and Laura will get in touch. We'll send you a wealth of learning resources, including this handbook. There will also be an essentials checklist on there, which gives really helpful guidance on things that you ought to pack, what the seasons are like in England. So pop in the chat where you're dialing in from today, because it'd be really interesting to see what parts of the world we're talking to today. So in Devon in the UK, we've had a lot of rain over the last few days, but it's still quite warm for us. So, and you'll probably laugh because a lot of you are dialing in from hot countries, but I'd say it was about 15, 16 degrees today, Laura. Would you agree with that?
Yeah, it's a nice day today.
Yeah, so that's quite pleasant and quite mild for us, but lots and lots of rain. So I know when we were speaking to Nalin from Sri Lanka, I think he was in the high 20s, so obviously a big difference there. So you'll get your essentials checklist, and at that point we will also make a WhatsApp group for you with the other members of your cohort group that will be arriving before to the trust that you've been assigned to, and that way you can get to know each other, make friends, and yeah, and then you don't feel so alone when you arrive. Now, the other reason we set up those WhatsApp groups is because I really encourage you to talk to each other before you arrive and practice your conversational English, okay? So we all know that working through the pandemic, there's been delays on some of you coming over, particularly from India, when you've not been able to come to the UK as planned. So it could be that there might be a little bit of a gap since you sat your English exam. So practicing that conversational English is absolutely paramount for you, to warm up those skills that you had and to get ready for when you start in clinical practice. Okay, so I'm just going to talk through the first bit of the OSCE book. So obviously, I'm sure you're all fully aware the exam you have to take is the OSCE, which is the Objective Structured Clinical Examination. So when you arrive to Devon, you will all of you be put on a training programme. In the main, you'll get 3 weeks of intense OSCE training, okay? Those of you going to North Devon, the Royal Devon and Exeter and Torbay South Devon will all have your training in the Exeter OSCE station training hub, and those of you going to Plymouth, they do it on site. So it's 3 weeks, Monday to Friday. All your transport in that has arrived, because I know that's a question I'm asked quite a lot. And you will live and breathe the OSCE for those 3 weeks, okay? I also advise you to get together in your study groups and practice it in the evenings, practice it at the weekends. You need to absolutely consume yourself with this for those 3 weeks to have the best chance of passing. So as trust in Devon, we pay for the first 2 sittings, okay? It's almost unheard of that you fail twice, all right? If you fail the first time, you only have to go back and resit the station that you have failed. But we have almost 100% pass rates in Devon, okay? And that's because of the support and excellent teaching that you receive when you're in Devon at our organisations. So you can see here, this book has been designed with all of the organisations that we work with in Devon, okay? So it's been a really good collaborative piece of work. So on here, we've got a bit of a foreword, and we talk about the NMC, which is what I'm going to go. And I know I did it last week. I'm going to do it again because it is so important. All right. So there's the code. OK, that needs to be ingrained with all of you. Please look it up if you've not read it, because that underpins all of the OSCE standards that you're expected to demonstrate. So it just says there about familiarising yourself with the professional standards. It's available online. The NMC website is excellent, and it is all on there. There's lots of videos you can watch, so please start to look at that. And also, I don't know if any of you have come across this before, we also use the 6 C's, which is care, compassion, competence, communication, courage and commitment. And that should be demonstrated in your exams as well. So when you're doing your OSCE exam, you should demonstrate that you're taking care of a patient with compassion, which I know you all do, but you need to be able to have demonstrated that in the exam. So there are 4 themes throughout the NMC Code, and that's prioritisation of people, practising effectively, preserving safety and promoting that professionalism and trust, okay, in all aspects of our life, okay. So a few weeks ago we had a really good webinar on with the Royal College of Nursing about social media, the perils of social media. So it might be that some of you might want to catch up on that from our YouTube channel if you've not seen it. And that really gave us some helpful tips on what we should and shouldn't be putting on social media. But my main advice for you would be social media and our professional life don't mix. I would say try and keep social media to your personal life. If you want to promote a trust page on your Facebook, that's fine. But I would say try and keep them separate. That's what I always do, just so that there is there's no confusion there. So just moving down the book. So obviously by the time all of you come to Devon, you would have all have done part 1, which is the computer-based test. That's the CBT. You would have all done your OET or your IELTS, and you will get authorization from the NMC to sit your OSCE. Okay. Now during the pandemic, a lot of the OSCE examinations were done with mannequins, okay, but I know they're starting to bring in real life actors now. So you will go into a workstation, a clinical exam station, and there will be an actor acting as the patient. All right. So there are 6 stations. So I'm basing this on the fact that probably most of you watching will be doing the old OSCE. So as you're probably aware, there is a new OSCE, and I think they've gone up to 11 stations. However, if you've done the old CBT, you will do the old OSCE. Okay, so that's just one principle to remember. So we've got the NMC expectancy here, and then what the workstation assessment will be on the right. Now, all of the information is in here. So when it talks about the news procedure, that's the observation tool that you'll use to take blood pressure, and it's a scoring system. All of these are available in the appendices at the back of this book, which you will receive. So you've got your planning there, your implementation, and the evaluation. So today I'm going to focus on the assessment, all right? So the principles for this is you're using the information that you've been given, and you need to demonstrate that holistic patient-centered assessment, okay? You've got to demonstrate clear documentation on the format and the templates that you are given in your exam. Keep your writing clear, because you will be failed on that if your writing is hard to read. You've got to make sure it's factual, what you're putting down. Make sure you've signed it, printed and dated it. I have known a nurse fail because they didn't print their name under their signature. So you need to be able to evidence that the care that you have planned for that patient is evidence-based, and you need to make that really sure. So link in with the NMC guidelines on records and record keeping, and that will really set you up for what's expected. So when you go into your planning OSCE station, it's a silent writing bay, and there will be an examiner in the room, okay? You'll have 15 minutes to write 2 aspects of care, including any relevant self-care. So when you start your OSCE training, you will all be given access to the Moodle page, okay, which is, most of you will sit your exams in Swindon, and it will be the Oxford Brookes Moodle page. And there are loads of practices on there you can do. You can make yourself familiar with the templates. And another thing to remember, always write in a black pen. So I'm sure that's the same in your countries, but in the UK, we have had to write in black pen for many years now, and that's to do with when we have to photocopy paperwork and documentation. So if you don't already do that, please start writing in a black pen. Are there any questions so far? Has anyone put in where they're dialing in from today, just out of interest?
Philippines, got people from the Philippines, so that's good. Lagos in Nigeria.
Hi Nigeria.
Hi Nigeria. And that's it so far. So
great. Okay, yeah, pop in if you've not put where you're dialing in from, because I'm just be interested to see. Okay, so what we'll do then, if we'll watch the Health Education England assessment video now, and then I will afterwards we'll go down through the OSCE book and we'll look at the planning one. No, what did I say? We've done assessment, it's planning. So we need to watch the planning video, please, if that's all right, Laura.
Of course it is. Oh, no, not that. Sorry. That's not what I want. This is what I want.
In this video, we'll look at the planning care as a part of the assessment, planning, implementation, and evaluation model. During the planning phase, you'll create one or more care plans based on your assessment of the patient. This is a written station. There is no interaction with the patient. In practice, as a part of the planning process, you'll have information available to you from a variety of sources. Make sure these are all utilized to support the planning of care for your patients. Be aware of the time of day noted on the provided documents. You must always check and confirm the patient identity on the care plan against that on the admission document. In practice, you will identify a range of problems for the patient. The plan must identify two nursing problems, one of which must be what the patient is presenting with. Care by nurses and self-care instructions must follow the SMART principles. The care plan must be listed in order of priority. List the most acute and urgent steps first. At least one item must be included in self-care column. Examples here could include: the patient is able to verbalize pain or nausea. The patient consents to treatment. The patient is able to self-medicate. The patient is able to use the call bell. Anyone using the care plan should be able to follow the plan in order to take care of the patient. Include action-focused steps such as check pain levels, escalate any concerns. The care plan should include follow-through actions. For example, if monitoring observations, have a plan of escalation. If giving medication, monitor effectiveness. Make sure that you include a date or time for the re-evaluation of the patient. If unsure, a useful tip here is to write re-evaluate at the end of shift or if patient condition changes. It's a good idea to have a final review of the document. Remember to check the following. The patient details match those of the admission document. At least one item is included in the self-care column. You have added a re-evaluation date. You have printed and signed your name and added a date. It is worth reviewing the Nmc Code, Professional Standards and Behavior for Nurses and Midwives, as this sets out clear guidance in relation to the completion of all documentation. In the next video, we will look at administering medication to the patient.
So that's that one.
Great, thank you, Laura. Okay, so what we're going to do is we're just going to scroll down through this booklet. Okay, so, and in this Oski Handbook, there's some top tips for reading, but did you hear that? So the clinical teacher on that video said about reading the code. So I can't emphasize that enough, okay, to look at the Nmc Code. And he also said that you'll have access to a wealth of information on the Moodle site, which is what I've said before. Right, so let's scroll down. And down.
Share it, lovely.
Oh, sorry.
We stopped sharing, didn't we, for the video?
You see, I just think I'm getting somewhere, being all technical and still a bit behind. Right. Here we go. So
there we go.
Right.
Got it.
So we did assessing last week, and we're going to do planning. Planning care, right. So as they said in the video, based on the nursing assessment you did before this, obviously we're doing AP, we did assessment last week, this is planning. You need to provide a nursing care plan for 2 of the nursing needs that you've identified, all right? So obviously you will be given a patient scenario and this section will be pre-filled. So for example, you've gone into do your AP, and on your assessment, your patient scenario is that the patient is asthmatic and they are also constipated, for example. So you would plan your nursing care based on 2 elements. So you could say asthmatic and constipation, and you would need to complete all sections of the care plan. So for date and time, assume it is that day, it's real time, okay? And then once you've filled out that documentation, the examiner will retain it and will be marking you on that. So the care plan. So you need to complete each section in black pen clearly, all right? Put the patient details, their name, age, date of birth. So then you put the nursing problem, need or activity of living. So there's different things in here such as nutrition, risk of falls, and this is all based around activities of daily living, which you will all be working from as a model of nursing, and that forms our sort of core nursing in the UK as well, those activities of daily living. And also we've got in there our aims of care. So we want the patient to be pain-free to reduce their anxiety. And a lot of that, reducing anxieties, will be how you speak to the patient in your examination, your reassurance that you provide. There's fluid balance in there. There's about safely recovering patients post-operatively. All right, these are all examples, but it'll all depend on the patient scenario that you are given. So the re-evaluation date. So don't put any longer than 24 hours. However, if the patient's condition changes, you would want to reassess your care, all right? So you'd assess and you do another care plan. So you also need to put that in, because we don't wait for the 24 hours has passed if a patient's condition has changed. We reassess and we put a different care plan in. So this is a care by nurses. You need to be really precise and detailed and just do one aim at a time. Don't make it too complicated. And the patient scenarios that you'll be given, they won't be massively complicated, all right? So keep it nice and simple. Think about the patient's safety and think about how you're demonstrating those 6 C's. So that compassion, care, competency, all right? So how you dictate your care plan will be based on what you have seen in your assessment and the patient scenario you have been given. Don't be creative. Don't make up what a patient can and can't do. Base it on the patient that you have been given, all right? Think about things about, do they have a call bell within reach? Okay, if they need to call for help. How do they wash and dress? So again, all of these activities of daily living. And then at the bottom of the care plan, you must sign and print this, okay? Please do that, because you will be failed if you don't, and put the date that you've completed your examination. So you put the nursing problem there. So let's say breathing, okay? So we've got a patient that's asthmatic. Nursing problem is, let's say, short of breath. So our aim of care would be to alleviate symptoms, ensure patient is not breathless and feels safe. And then you'd put, we'd provide reassurance, we'd administer the medication as prescribed by the doctor. You might want to think about things like providing them with a fan if they're short of breath, or popping their bed next to a window. That's all those sorts of psychological factors that really help a patient when they're short of breath. The re-evaluation date. So it's 24 hours from your plan of care unless the patient condition changes, okay? So in here you put the care by the nurses, and then the patient self-care. So that's pretty self-explanatory. And again, print, sign, date, okay? And then you go on to the next problem. So let's say constipation, aim of care to alleviate symptoms of constipation and ensure patient is having regular bowel movements. How are we going to do that? Well, it depends on the patient really, doesn't it? But you could, you might want to administer bowel therapy, increase fibre within diet, ensure the patient's drinking plenty of fluid, all those sorts of things that you all know that might give you an idea of what the sorts of things you need to put down. So it's not here to catch you out. And again, reevaluation date, 24 hours or sooner if patient condition changes. Sign, date, print. So could we just go on to the safe administration of medications video, because we're on to the I section of the APIE. We've looked at assessment. Planning's quite a straightforward one. If we look at implementation, and this is about the safe administration of medicines. Yeah, so we'll just look at that video now and then we'll talk through it again.
Yep, implementation coming up. Oh.
In this video, we'll look at the implementation process as part of the assessment, planning, implementation and evaluation model. In practice, the processes involved in this stage of the model are more comprehensive and diverse. Here, we will highlight areas that will support you in preparing for the Nmc OSCE. As part of this process, you will administer medication to the patient based on the information provided in the prescription chart. It's worth looking at the Nmc Standards for Medicines Management, as this sets out clear standards in relation to the administration of medicines. Remember to continually speak aloud to explain your actions, even when not addressing the patient, for example, when reviewing the prescription chart.
Turning the page of Cardex, I see that the patient is allergic to ibuprofen and the patient gets bronchospasm and rash.
Before approaching the patient, look out for the same things as you would when undertaking an assessment. Check the scene safety and look out for any items which could pose hazards or inform your actions.
I enter the room, I check for the scene safety. I see that the room is safe to approach. I make sure that the curtains are drawn to maintain the privacy. I perform my hand hygiene.
At this stage, as with any patient interaction, effective communication is essential. During the exam, the patient is represented not by an actor, but by a mannequin. Try to interact and communicate with the mannequin as you would a real person. An assessor will respond to any questions that you direct to the patient.
I am Bincy and I'm the nurse who will be taking care of you today. Can you tell me your full name, please?
Yeah, I'm Mark Brown.
Okay, and your date of birth?
Yeah, it's the 25th of September 1957.
All right, am I okay to look at your ID band?
As part of safe administration of medicines practice, you must always confirm the patient's identity. Ensure the name, date of birth and hospital identification number on the prescription chart corresponds to the details on the patient's identity band.
So your name is John White. Your date of birth?
1st of Jan 1960.
So it's 1st of 1st 1960 and your hospital number is 010101.
In addition, you must always check for patient allergies and ensure that the patient is not designated as nil by mouth.
Mark, do you have any allergies?
Yeah, I'm allergic to ibuprofen.
Okay, and what exactly happens when you take ibuprofen?
It gives me an itchy rash and a bronchospasm.
All right, so I'll make sure that I don't give you this drug, okay?
Okay.
Can I take a look at your allergy band?
Okay.
So it says you're allergic to ibuprofen, all right.
Explain why you're there and ask the patient if they're experiencing any pain, making it clear which pain scoring tool you're using.
So Julia, I've come to give you a due medicine. So have you got any pain now?
I've got a little bit, but not much better than it was.
Okay, so could you score your pain on a scale from 0 to 3, where 0 means no pain and 3 is the worst pain you've ever had?
It's probably a 1.
Okay, so do you want any pain medicines now?
No, I'm fine, thank you.
All right, Julie.
Where appropriate, ask the patient when they last ate.
So when was the last time you had any food?
Before I went to theatre.
So you've not had anything since you came back, isn't it?
No, they just said I can just have sips of fluid, so I've just been taking sips of my water.
Oh, that's fine.
A useful memory aid when reviewing the prescription is to check the 5 R's. Check each section of the prescription chart or Cardex carefully, starting with the details of the patient, any allergies and any medicines already taken.
So the patient is allergic to penicillin and gets anaphylaxis. Patient's height is 5 foot 3 inches and weight is 9 stone and 2 pounds. Patient's already received a 5 mg of morphine IV at 12:45 and 50 mg of cyclizine IV at 12:45. There's no oxygen prescribed, and patient has also received a PRN dose of paracetamol 1 gram at 5 o'clock in the morning.
Read through each item on the prescription, checking the 5 R's in each case.
The regular medications. The drug is ferrous sulfate. Date today. Dose 200 milligram. Frequency daily. Route is oral. Duration 2 days. Start date is today. Finish date is after 2 days. Prescriber signature and bleep number is present. So I'm going to take this medication, ferrous sulfate.
In practice, not all prescriptions are completed correctly. If you do not give a drug, then you need to record the reasons for non-administration on the prescription chart using a coding system. A standard system is usually found on the prescription chart for you to follow. Some common errors to be aware of include: the patient may have already received a dose of something.
Prescription is complete with the signature and the bleep number, and it's due now. But because the patient has already received a start dose of cyclizine 50 mg at 12:45, I wouldn't be giving that now, and will put a clinical code of 2 saying it's omitted for a clinical reason.
The patient could be allergic to the medicine.
Patients prescribed amoxicillin. Starting date is today. Dosage for 500 mg for 3 times a day to be given orally for 5 days. Prescription is complete with the signature and the bleep number, and it's due today at 18. Since the patient is allergic to penicillin, I'm not giving amoxicillin now and putting a code of 2 saying it is omitted for a clinical reason. I would be checking with the doctor whether the patient needs any alternative antibiotic.
The dose given on the prescription is wrong.
So in the regular medicines, the patient has got furosemide, dose 400 milligram daily per oral for 3 days, and the start date is today. But the dose seems to be high, and that's a wrong dose. So I will not be administering this drug. So I need to confirm this with the doctor, and I'll ask him to re-prescribe the drug. I'm putting a code of 6. That's for the wrong dose.
The patient might have had a stat dose. Remember, this is recorded elsewhere on the chart, and you should check with the patient before giving anything.
The patient is prescribed cyclizine 50 mg to be given 8 hourly maximum, and to be given orally for 2 days, and starting date is today, finishing date with the next 2 days. Prescriber signature as well as bleep number is present, and hence prescription is complete and it's due now. But since the patient has already received a start dose at 12:45, I wouldn't be giving cyclizine now and put a clinical code of 2.
The prescription is incomplete or has not been signed.
Next, patient is prescribed ferrous sulfate. Starting date is today. Dosage 200 mg to be given once a day orally. It's an ongoing prescription, but the prescription is incomplete without the prescriber's signature as well as the bleep number. So I wouldn't be giving the drug and putting a code of 6 saying it is omitted because of incomplete prescription.
The start date is incorrect.
The next drug is amlodipine. Date is today. Dose 5 milligram. Frequency once daily. Route is oral. Duration ongoing. The start date is tomorrow, so I'm not going to give the medication.
You should take steps to address these errors and state what you've done. Some medications require the patient's current observations to be known before administering. The assessor will provide you with this information when asked.
Next drug is bisoprolol, and it is 2.5 milligram once a day per oral, and the start date is today with the doctor's signature and the bleep number, and it is prescribed for 10 o'clock. So before I give this drug, I need to know the blood pressure of the patient.
100/60.
Because the patient is hypotensive, I will not be administering this drug, so I'll be putting a code of 2 that is omitted for a clinical reason.
If unsure of any aspects of the drug prescribed, such as dosage or side effects, you should refer to the British National Formulary, or BNF.
I would like to check the BNF to see whether the dosage is right. Checking the BNF for the simvastatin's dosage.
Once it is established that the prescription is correct, a full inspection of the medicine has to take place. Check the medicine packaging, paying attention to the expiry date, batch number, dosage, and any side effects. Make sure you check this information on the blister packs inside the box too, not only on the box itself.
So I'll be taking cefuroxime. Cefuroxime, the dose available is 250 milligram and the expiry is November 2017. I'll be checking the inside label as well. It's cefuroxime 250 milligram, expiry November 2017. So since 750 milligram has been prescribed, I need to take 3 tablets of this into my medication pot.
As you dispense the medicine, make sure the correct number of tablets are placed in the medicine pot. If decanting from a bottle, first dispense the correct number of tablets into the lid of the bottle and then put into the medicine pot. Remember to state aloud what medicine and what dosage you're dispensing.
I've got simvastatin 10 mg tablets here, expiry February 2018. So I'll be taking 2 tablets out of that because I need 20 mg.
Prior to administering the medication to the patient, a second ID check must always be completed.
So before giving the medications, can I just tell you to tell your name again?
John White.
John White. Okay, can I check your ID, ma'am?
Yes.
Okay. John White, and your date of birth?
1st of Jan 1960.
1st of 1st, 1960, and your hospital number is 010101.
Explain to the patient what you will be giving them and any reasons why you're unable to administer any of the prescribed medication.
So Julie, I've got a tablet named simvastatin. So have you ever had that before?
Oh, I'm not sure.
So do you have high cholesterols?
Yeah, I do, yeah.
All right. So this is for reducing your cholesterol level.
Yeah, that is, yeah. It's like the statin-y one, isn't it?
Yeah, it's exactly. It's simvastatin. Also, you're prescribed an antibiotic named amoxicillin, but because you're allergic to penicillin, I don't want to give you amoxicillin. I'll speak to the doctor and see whether you can get an alternative antibiotic prescribed.
Explain any side effects that might be experienced.
So Jack, I'm going to give you ferrous sulfate tablet, 200 milligram. Is that okay? So do you know for what do you take this tablet?
No.
Okay, this tablet is your iron replacement, and one of the main side effects of this tablet is your stools might turn tarry. So you did not worry, it's a common side effect. It won't affect you in any way. So is that okay?
Part of the prescription check may indicate the patient has an intravenous cannula. You should check this is running at the rate given in the prescription chart. You should also assess the cannula site for swelling and pain using the VIP scoring system.
So Jack, I'm seeing an IV fluid running out in the cannula. Can I check your cannula site, please?
Yes.
Okay. So I see the cannula is patent. There is no signs of infection, inflammation. There's no signs of thrombophlebitis. Are you experiencing any pain, Jack?
No.
So the cannula is patent, and I'm going to do a VIP chart regarding your cannula, okay?
Immediately before administering the medicine, check if the patient has any problems swallowing.
Are you okay to take the tablets now?
Yeah, that'd be fine.
Have you got any problems swallowing?
No, no.
All right, I'll get you some water.
Pass the tablets to the patient using a medicine pot. Do not pass by hand.
So here's some water for you. Would you like to take these tablets now?
Once the medicine has been administered, confirm the patient has swallowed the medicine by asking them and visually inspecting their mouth.
Am I okay to check your mouth? All right, I see that they've all gone in.
Update the prescription chart to document which medicines have been given.
So now I'll be doing the documentation of the drugs that I have given. So since I have given cefuroxime 750 milligram, I'll be signing it for today. And also have given digoxin. So I'll be putting in today's date.
Make a note of any drugs that have not been administered. Include the code that indicates the reason why. This needs to be entered twice on the chart, once where the drug is prescribed and also in the drugs not administered section towards the back of the chart. Any oral fluids have to be documented on a fluid balance chart if one is present, including the amount of water given when the patient took their medication.
And meanwhile, I'm going to go and do the documentation about the medication. I see that you have an IV fluid, so I'm going to document the IV fluid as well, and I'm going to record an intake output chart for you.
Be prepared to answer any questions from the examiner.
Could you tell me what you would do if the patient wasn't able to swallow?
Okay, if the patient is not able to swallow, I'll just ask the pharmacy if any other form of medication can be given to the patient, like a liquid form instead of a tablet, as well as I'll just speak to the doctor to see that if any other medication can be prescribed for the patient.
To ensure patient safety, you should monitor the patient for any side effects and ensure they have means of contacting you. You should also ensure the clinical environment is safe, all medicines are secure, and clean your hands before leaving the area.
So now I'll lock my trolley and I'll keep it secure and safe. So Mark, I'll be here for the next 15 minutes just to observe if you've got any adverse reactions to the drugs that you've taken right now. All right. And before I leave, I'll be giving you this buzzer. I'll leave it in your hand. So just press the buzzer if you need anything. Is that okay?
Okay, will do.
Okay. So before I leave the room, I'll just do my final hand gel.
When administering medicines, some of the key points to remember are: check the prescription carefully to ensure the prescription is complete and to look for errors. For example, an incomplete prescription where the doctor has not signed the prescription chart. If unsure about any details in relation to the drug, look up the medicine in the BNF. Wait to confirm the patient has swallowed the medicine before completing the documentation. Accurately complete all documentation, including any codes for drugs not administered. Now you have completed the implementation stage, we'll take a look at the final part of the model, evaluation.
That's great. Thank you, Laura. So I hope that gave you some insight into the how it's going to be when you go into that bit. So obviously that was the safe administration of medicines, and that's the I of the AP, which is implementation. Right, I'm just going to screen share again, and we'll go through that part in the handbook. Here we go. Right. So safe administration of medicines. So obviously the scenario will be pre-filled depending on your patient scenario. And as you saw the gentleman in the video, you need to talk to your patient. If it's a dummy, you need to talk to them like it's a real person. And I know that may feel a bit false, but it's just for the purposes of the examiners, so they can see your communication skills and make sure that you're delivering in a compassionate way. You need to really verbalise what you're doing, and that may also feel a bit false and a bit uncomfortable, because ordinarily you wouldn't talk through every single thing when you're with a patient, but you have to do that for the purposes of the exam. Read out the chart and explain why you're checking and giving or not giving. And the example that we've just seen, so there was a medication written on that drug chart that had not been signed for, so you need to be on your guard for things like that. And obviously the nurse didn't give it because it hadn't been prescribed properly or signed for. They may put something in there like that to catch you out, and that's absolutely what would happen in reality. We know in our clinical areas sometimes the doctors don't get it quite right and they might forget to sign something, and we mustn't give it. But also it doesn't stop there, does it? We don't just not give it. We then say we're going to contact the doctor as soon as possible and get them to come and sign for it, because otherwise that patient has got an omitted dose of something that's really important for them. You'd complete all the drug administration checks, ID. So they did name, date of birth, hospital number. There's 3. Okay, remember that: name, date of birth, hospital number. Use the correct documentation, and there will be codes. So for example, like in that scenario, the doctor hadn't signed for it. There will be a code that you can write on the chart for that. Make sure you use them properly. So you've got 15 minutes. That's the longest station you'll have. All right. So there is an NMC standards for the administration of medicines. Look it up. OK, go and have a look, have a read through. So this is the example of the prescription chart that you will be given in your exam. Dependent on what hospital you go to, they will have a different prescription chart, but the contents will be the same. It will just be a different layout. All right, but this is the one you will get in your exam. So it'll have patient name, when they're admitted, what time, hospital number, date of birth, and then you've got the known allergies or sensitivities. So my top tip for you, is to check that chart from front to back. Okay, do that in your everyday practice, because you don't want to miss anything. And our drug charts are very comprehensive now. They have IV fluids on there. They have the insulin doses. It's all on one drug chart. So go from front to back and you won't miss anything. So you've got allergies on the front. And then here, information for prescribers. So there's some helpful information here. Use your block capitals, sign and date. Record details of allergies, and then information for nurses administering medicine. So obviously you would time, date and sign when you've given something, or the following code underneath. So in that example, they would have put down a number 6 because it was an incomplete prescription. All right. If it was a wrongly prescribed prescription, so for example, if you've gone in to give a patient a medication and the dose is too high and you've checked your hello? If you've checked your British National Formulary, so they talked about it on the video, that's a BNF, all right? That's a little book, and it's got all the doses and proformas and formulas for all the medications we give. If you think something isn't right, you need to check it in the BNF, because we know that people make errors and doctors may have wrongly prescribed that and you would not give it, all right? So you would just work down through this chart. Stat doses are there. So for example, if they've come in with a cellulitis, they might have been prescribed, excuse me, a bolus dose of an antibiotic, which we've written in that section. So an oxygen, it will be in that box. PRN medications. So painkillers is one of the most common ones for PRN, isn't it? And it's really important you ask the patient, have you got any pain? Every time you see a patient, you need to be assessing their pain. So this is the antibiotic section. They'll be written on here. So it could be that they've had a stat dose of an antibiotic, but then they're written up on a regular basis here, okay? Please pop your clinical questions in the box, guys, if you've got any. And this will be where the regular medications are. So for example, the named medication will be written in there. So it might say Ramipril and it will have the dose. So I don't know, 2.5 twice a day, PO, duration, and then the doctor will put in there however long they want them to have that medication, okay? If you can't read it, don't give it, okay? You need to be safe. So intravenous fluid therapy will be written here. So if they've come in with, if they're septic, dehydrated, there'll be bags of fluid written there. So you would talk through that. And then drugs not administered, okay? And it's good, that will be pre-populated for the exam. So remember, what is this drug? What does it do? And is the patient willing to take it? All right. So, you know, as the gentleman in the video showed, you need to be talking through, do you know why you're taking this? You know, and make sure they are fully aware of what they're taking. Is it the right dose? You know, although we don't prescribe, we are responsible for that administration of medicine. If we give a medication that's been prescribed too high, we are responsible for that also. So you really need to make sure the doses are correct, and that's where our BNF comes in handy. It's been given at the right time. So we know that there are safety critical medications, aren't there, for patients that may have Parkinson's, that have to have their patients at their medications at the right time. So you need to be considering all of this. Has it been given in the right route? All right, has it been prescribed correctly? Right, I'm just going to jump on and see if there are any more questions.
Sorry, which video was it you wanted, Carly? Sorry.
That's all right. No, we've just finished Administrator of Medicine, so I think we've probably got a bit of time to do the meditation one now. So
Fab.
We've done assessment, planning, intervention. Next week I'll try and get time to do evaluation, and then we've done AP.
Okay.
I've developed a tickly cough during this call. Sorry guys. So what we'll do, I'm going to do a bit of meditation now with a video designed by the Royal College of Nursing. It's really important that we all take time out to look after ourselves. You know, as nurses, we're all really tired, aren't we? We've worked through the pandemic, and you in particular, you're looking at relocating to a different country. So we really understand and appreciate the pressures that you're under. So please try and take some time. It's only, we've probably got time to do most of it.
Okay.
And just take this time out. This is all about self-care, and we look forward to seeing you next Thursday. So remember, give us a like, give us a love, and give us a share. Tell all your friends about us, and we can't wait to work with you in Devon.
And we'll see you next week.
See you next week.
Doing a frontline caring job means you see and hear a lot of things. And when you signed up, you knew there would be challenging days, stressful days, hard days. And you didn't expect every shift to be this hard. So it's time to let go. Let go of what happened in that shift. And let go of the thoughts about the next shift. And focus on a very different shift. A shift in the way you're thinking. And before you start to unwind, find a suitable place to sit quietly or lie down. You might want to use this audio just before you go to sleep. And please only listen when it's safe to do so. Now, let any thoughts of PPE, COVID-19, the healthcare trust, the patients, your colleagues, the government, the non-stop news, let those thoughts become blurred. Literally, blur the image of them in your mind and begin to listen to my voice and focus on yourself. Starting by making yourself comfortable and become aware of your body. Start by taking a long breath. Not a deep breath, a long breath. I'm guessing you know a little physiology, so focus on the diaphragm and visualize that diaphragm moving down to create a larger space in the chest cavity, which allows those lungs to expand and fill, allowing the air to reach every part of the lung. And then take another long breath. And if you haven't already, you might want to close your eyes now and notice your surroundings. Notice where your body touches the chair or bed or couch. Notice the temperature of the room. Notice any sounds beyond the sound of my voice. And any sounds in your environment will simply help you to relax more deeply. And if any other thoughts pop into your mind, notice them too. Then let them go. Now, begin to relax. Starting at the top of your head, aware of the scalp and the follicles. And just imagine you can soften and relax the little muscles and begin to feel the feeling of relaxation moving down your face, softening the little muscles across your forehead, flattening out the old lines, letting them melt away, and soften and relax the little muscles in your cheeks and the little muscles around your mouth, the ones that can make you smile or frown. and notice how your face feels free from the constraints and a surgical mask. And the tongue, it's just another muscle, so you can relax it and begin to realize that we all do many things unconsciously, actions and thoughts, and your unconscious is very, very powerful. It controls many parts of you, like the swallow reflex. We all do it, and we never have to think about it, because your body knows what is best for you. And when it needs to remove the saliva, it swallows, and you don't have to think about that. In fact, you don't need to think about anything. Just relax. Many people carry a great deal of tension in their jaw, sometimes grinding teeth at night. So notice your jaw now and imagine softening the muscles and tendons and letting the tension go. And remember, if a thought pops up, notice it and let it go. Blur it out and take your attention back to your body. Right now, the neck and shoulders. A deeply skilled masseur friend once told me that she could feel exactly how stressed a client was by feeling the tension in the neck and shoulders. And as a deeply skilled masseur, she would use her knowledge and experience and gentle, deliberate movements, maybe a little aromatic oil, to manipulate the tense muscles and tendons and physically help increase the flow of blood and reduce pain and create a feeling of deep relaxation. And by vividly imagining those muscles in the neck and shoulders relaxing now, you can create the same effect. That's right, softening and relaxing and calming. Now take your attention to your left arm and just relax each muscle in turn, the extensors and the abductors. And you might notice the odd involuntary twitch as your arm begins to let go of the tension of the day. And take that feeling right to the tip of your fingers and repeat for the other arm. That's right, softening and relaxing every muscle, every tendon, every molecule. And again, any twitches or involuntary movements is just your body resetting as you let go and begin the shift of your mindset. Now, soften and relax the muscles across your chest and abdomen, and imagine you could move all the way down your spine, softening and relaxing the connective tissue, and feeling the feeling of calm and relaxation. And take your attention inside. Focus on the internal organs, starting with the lungs. As they inflate, as your diaphragm drops down, become aware of the air entering through the nostrils, aware of the temperature as it reaches your lungs, and stop for a moment. As you exhale, imagining letting go of all the stuff that's happened today, and begin to remember the biology of gaseous transfer, as the lungs extract the oxygen and the heart, just another muscle, pumps that blood around your body, and your unconscious takes care of this. You don't have to think about it beating away in a way that you've seen so many times on the monitor. It just does. And as you go deeper, deeper into your own body, relaxing the muscles and fibers and tendons, take your attention to the legs. Nursing staff spend a great deal of time on their feet. Imagine the tension melting away from those quads which have done so much work today. Feel the release as the calf muscles relax, and begin to notice the temperature of the soles of your feet. Those feet that keep you literally and metaphorically grounded. And as lockdown can feel like being grounded, know that there is an end. That as things shift again, it's just learning. And right now, you are safe and you are appreciated. There's always a tendency to rerun a shift, particularly a bad one. And all that we achieve from that is to feel the bad all over again. So when that thought comes to your mind, stop and choose to rerun a different memory. A memory of a good time you've had as a carer. Go on, think of one now. A time when you were at the top of your professional game. A time when you were really living the reason you joined the profession. Get a specific memory in your mind and rerun that now. See what you saw, hear what you heard, and feel the same feeling of good you felt then. Keep rerunning that event. Make the image bigger, brighter, more colourful. Make the sounds crisper. And allow the feelings of good to fill your body from the top of your head to the tips of your toes. And remember to hold on to that feeling, because as you reconnect with that good feeling and think back over the past few weeks with this feeling in your body, the challenges can begin to fade and blur. And tonight, as you sleep and dream, sleeping and particularly dreaming are very important in allowing yourself to let go. Sleep is a series of phases. First a light sleep, a delicious doze. Then we move into a deep, refreshing sleep, where the body rebuilds cells and rejuvenates from a hard day. Then we go into the rapid eye movement, or dream sleep. And in dream sleep we review and organize the things that have happened in a day, or maybe over a longer period of time. And tonight, as you sleep and as you dream, allow your unconscious to reorganize the experiences and memories and feelings of the day, and let go of the ones you don't need, and remember the good ones. And each night we go through 5 or 6 or 7 cycles of light sleep, deep sleep, and dream sleep. And with each cycle you can begin to re-find your strength and your purpose and pride of being part of the nursing fraternity. And in a moment, I'll count backwards from 5 to 1, and at 1, you can reorient to your surroundings, feeling refreshed and empowered and ready for whatever life brings. And before that, just get an image of yourself looking fresh, bright, alert, and ready for another new shift? How would you stand if you were perfectly ready? Notice your hair, your work clothes, looking sharp and beautifully laundered. Notice that sparkle in your eyes. Where are your hands? Make that picture bright, colorful, being the best you. And add your favorite track of music and notice how that lifts the perfect you. Then imagine you could float into that perfect you and see through those eyes and hear through those perfect ears and feel how good it feels. And be that you as you move to your next shift. 5. Take in a long breath. 4. Remember what you need to remember from today, and remember to let go of the rest. 3. Notice the changing tone of my voice. 2. Become more aware of where you are. And 1. Open your eyes and have a stretch and a yawn, and remember, you can listen to this again at any time and perhaps have a different experience. Thank you for listening, and thank you from a grateful Great Britain.
Thank you. Take care, everyone.
Hi, my name is Lisa. I'm one of the senior charge nurses for the mental health hub here at NHS 24, and mindfulness is a big part of the hub. We do it over the phone and we do it as a team every Sunday night, and the staff report back that they sleep better that night. Mindfulness is something that you can do anywhere, any place. We first started it years ago in the wards with adults that were struggling to sleep at night, and we would bring in diffusers.